Hello, and welcome to OBGYN Made Easy. I'm a board certified OBGYN. I have a background experience in the United Kingdom
Magnificent.
before I moved to Texas, where I finished my residency. Hey y'all! And currently I'm practicing in California. If you're a student, a resident, or somebody who wants to know about OBGYN in a very simplified way, you've come to the right place. I believe in a very simple fact is that if learning is not fun, you won't memorize it at all. So let's have some fun and jump right into it.
Alright guys, a very important subject, which is miscarriage. And like everything else, we start with the definition. And simply, miscarriage is defined as pregnancy loss before 20 weeks of gestation. One of the main things that I've noticed is that my students always struggle to differentiate between different types of miscarriages. So we're going to talk about all of them today, and we're going to learn how to manage each one of them. On many occasions, patients come in for a routine prenatal visit. They feel completely fine without any symptoms. But when the doctor performs an ultrasound scan, they find no fetal heartbeat. And that's the easiest type to diagnose because it's missed by the patient, and therefore it's a missed miscarriage. On the other hand, patients may present to the ER feeling generally unwell. They might complain of pelvic pain and maybe purulent vaginal discharge. They feel hot and febrile. This is a septic miscarriage, and it's important to quickly diagnose and treat this condition. The most common presentation, however, is bleeding and to a lesser extent pelvic pain. Now the question is, how are we going to differentiate between different types of miscarriages and their treatments? Well, it's a reflex to do an ultrasound scan on a pregnant woman who complains of bleeding in the first or the second trimester. Ultrasound may show a fetus, in which case the diagnosis is either threatened or inevitable, or retained tissue, in which case the diagnosis is incomplete. The other important aspect to tell which kind of miscarriage the patient is having is the cervix. And if the cervix is open, the diagnosis is either incomplete or inevitable. Comparing that with a closed cervix, in which case the diagnosis is either threatened or a complete miscarriage. Now we come to the important stuff, which is management. And we can divide the management into medical, which includes misoprostol and mifepristone, or surgical, which is what we call suction evacuation, commonly known as D&C. Two special situations where you don't have the time to use medical management. Those situations are if the patient is having a septic miscarriage or in case of a hemodynamically unstable patient. In those situations, you have to use surgical management. If the patient is diagnosed with a missed or incomplete miscarriage and is hemodynamically stable, you can use medical, surgical, or simply wait for nature to take its course, which is what we call conservative management. If you diagnose a patient with threatened or inevitable miscarriage, involve the patient in the decision making. Inform the patient that there is still a possibility they might lose their pregnancy with a threatened miscarriage, and more likely than not, they will lose their pregnancy with the inevitable, in which case you can offer them medical or surgical management. With the complete miscarriage, your job is done. After diagnosis and management of a miscarriage, it's important to follow up on patients. Therefore, you can advise the patient to perform a pregnancy test at home, or they can come into the office and do a pregnancy test there, and you want to have a negative pregnancy test to ensure there is no retained tissue.
Don't forget to check out my books on Amazon. One of them is called OBGYN Made Easy, Don't Waste Time on the Shell, The Pearl is Inside, and the other one is for questions and answers. And the links are provided below. If you want to support this channel, please like and subscribe. If you have any question or any suggestions, please leave them in the comments below and I will do my best to address them. Guys, my commitment to you is to provide you with the latest information based on the most recent American College of Obstetrics and Gynecology guidelines. Thank you and see you next time.